Okay, here we go. We are recording. So given that Welcoming America members have this sort of range of understanding of language access resources, the best practices having to do with language access and different language access levels of experience, this workshop in particular is going to kind of talk about a solid foundation for advancing language justice in general. We're going to cover basic concepts about language access and language justice. We're going to talk about some definitions, and we're going to really do a deep dive into empathy and understanding the English learner experience. And my hope is that this can create a basis of common knowledge for all of the future workshops. I hope that members of all levels of experience with language access can gain sort of new perspective or helpful practical information. But if this is all new to you, please don't hesitate to ask questions about any of the vocabulary, any of the information, or the resources that I'm going to share. And if you do have experience with language access, please feel free to jump in and share your experiences with the group. I think that the more interactive these sessions can be, the more valuable they'll be to everybody. So my hope for these presentations in general is that they can all be discussions, like I said, not just hour-long narrated slide decks. I would love for you to participate. I welcome all of your questions and input. Feel free to use the chat box or to speak up at any point during these presentations. I won't be able to see the chat box while I'm sharing my screen right now. But when we get to the guided discussion portion of today's presentation, I'll have access to all of that, and feel free to speak up if there's something that you're curious about immediately. So this is the first in a series of 10 workshops that are designed to give participants sort of a holistic conceptual knowledge of language accessibility, as well as the applied skills needed to improve language accessibility infrastructure within your communities, and in particular during COVID-19. And we're going to cover today just, what is language access? What are some key concepts, definitions, the legal basis for language experience, and in particular, the lived experience of English learners. And that means understanding, what people are dealing with when they have to navigate the world without access in language. So just to give you a very brief bio of myself, my name is Jayne. I'm the founder and director of a social enterprise called Global Wordsmiths that works specifically to advance language access. We're located in Pittsburgh, Pennsylvania. I'm also adjunct faculty and lecturer of global communication and applied translation at Carnegie Mellon University. And I'm the co-chair of the Pennsylvania Immigration and Citizenship Coalition Board of Directors. I'm a trained Spanish translator interpreter by trade. I lived abroad for about 6 years, and I worked as an interpreter, in particular for social service providers, for about 15 years. And so I got a really good look at what people's needs are, and in particular in small cities and Rust Belt cities. So I have a lot of experience on all sides of language accessibility as a consultant, as an industry executive, and also as a translator interpreter. And all of my work is centered around language access. So I live and breathe this stuff every day, and I hope that you can use me as a resource in any way that you need for the next 3 months through this awesome program. So, oops, here we go. I want to start at the very beginning for the benefit of those of you who do not have prior experience with language access, and share just a few terms that you're going to hear throughout this series of workshops and just in general in the field of language access. I'm going to send out just a brief glossary that was sourced from lep.gov after this webinar, or after this workshop, along with some other resources to follow up on today. But to start, there are just a few terms that I think will be helpful to you. And because I am going to send out that worksheet, there's no need to focus too much on memorizing these or worrying about them too much. One is just effective communication. In the context of language access, You know, effective communication is more of a legal concept, and that's just communication that is sufficient to provide an English learner with substantially the same level of access to services received by individuals who are not English learners. So for example, staff members of organizations must take reasonable steps to ensure communication with an English learning individual is as effective as communication with others whenever they are providing similar programs and services. The next definition is limited English proficient, or LEP individuals. And that is sort of the legal term and the generally accepted term by legislative bodies of individuals who do not speak English as their primary language and who have maybe a limited ability to read, write, speak, or understand English. LEP individuals may be competent in English for certain types of communication, like speaking or understanding, but still be limited proficient in other purposes, such as, or in other modalities such as reading or writing. English learners ostensibly means the same thing as limited English proficient, but it's the term I prefer to use opposed to LEP, and we'll talk about why that is shortly. But LEP is indeed the legal term that you'll hear most often when you're looking at regulations or dealing with government to serve this population. Meaningful access is another important legal concept that we'll learn. Meaningful access is language assistance that results in accurate, timely, and effective communication at no cost to an English learner. Bilingual helper is, you know, somebody who's a staff person or an employee who has demonstrated proficiency in English, in reading, writing, or speaking at least one other language as authorized by his or her component or, somebody within their organizations. But for limited English proficient individuals, meaningful access denotes access that is not restricted, delayed, or inferior. So this means that bilingual helpers basically are not qualified or certified professional interpreters, and therefore may not be able to provide meaningful communication, meaningful access, even though they're well-meaning. A qualified translator or interpreter is an in-house or contracted translator or interpreter who has demonstrated his or her competence to interpret or translate through some sort of certification process, or is otherwise qualified or authorized to do so, just by virtue of previous experience or training that they can demonstrate. And finally, a vital document is some sort of paper or electronic written material that contains information that is critical for any programs or activities or that's required for law. And so an example of this would be, when you're talking about using like Google Translate or having things translated by bilingual helpers as opposed to trained translators and interpreters, you wouldn't want to do that with anything that's vital. And that could be the difference between sending, a reminder note to somebody about an appointment, which is not necessarily a vital document, versus, epilepsy medication instructions for an infant, which certainly is considered vital, right? So there's a spectrum of consequences and importance there in terms of what needs to be translated by a professional. And I think that's an important definition to have. So skipping past that now, we're going to jump into what language access actually is, right? So language access is defined by the U.S. Department of Health and Human Services simply as what is achieved when individuals who have limited English proficiency can communicate effectively with your program staff and participate in your programs and activities. LEP, we talked about a little bit earlier, is the legal term, and it's the term that's most frequently used by government and lawmakers, but I prefer the term English learner, and a lot of people use the term English learner instead of LEP because when you think about it, LEP really focuses on a deficiency, which can create a bias, whether you're aware of that bias or not, rather than communicating positively about a person's strengths. So, you know, when you say somebody is LEP, you're saying that they're limited or deficient in some way. And this can kind of cause the narrative to assume that English learners are needy or lacking somehow, when really they are capable human beings who do not necessarily need us to speak on their behalf. They just need equitable access. And since immigrant and refugees communities are so often lumped together and viewed as needy or unfortunate, vulnerable, marginalized, little things like this really matter, because all of those words are negative and they create a bias even in well-meaning advocates, because it's really easy to sort of fall into the trope of thinking of people as vulnerable or helpless or as needing to be saved, quote unquote, but really they just need access and equity and justice. And so the question, what is language justice, you know, sort of starts there with checking our thought patterns in our own advocacy work or in the services that we provide in our legislative work. And I think that reframing the way we think about people and talk about people really matters. So you'll hear me use LEP and English learner kind of interchangeably throughout this and all of our workshops, because they sort of have different functions. But, you know, English learner is my preferred term, and I think it's really important to even just be aware of the way that we're thinking about and talking about the individuals that we serve. So language access is a procedural term. It's a legal term. It's a set of best practices or policies, and language justice is a different thing. Language justice is social justice. It is human. It means equitable access to the services that people need to survive and to thrive. It means integration, and it's leveling the playing field and sharing responsibility. It's actionable, it's urgent, and it's vital, especially during emergent situations such as COVID-19. And I'd love to ask for your participation now. And so the reason I want to ask for your participation is, one, to kind of reinforce that I want these sessions to be interactive, but also to get us really thinking about what it means to be an English learner in this country. So I'd love to hear from all of you. So if you can unmute yourselves and say out loud, you know, your name, your organization, super briefly, and then share with the group, you know, what do you think are situations in which you think language could be a barrier, right? So this can be anything. This could be, you know, catching the bus or being able to make an appointment, and everyday services that you need or that you use that would be difficult to access without language support. And I want this to be kind of deep dive stuff. So not just healthcare broadly, but specifically, you know, mental health services or prenatal care, for example. So I'll start to give an example. My name is Jayne. I'm the founder and director of Global Wordsmiths in Pittsburgh. And an example to me of somewhere, a situation in which language access is important would be public transportation. So now you go. Oops. I'm having trouble hearing you. I'm going to unmute you all.
Thank you. That's why we couldn't unmute ourselves.
Ah,
it said the host muted, like we were trying to unmute, but it said the host muted us, so we couldn't unmute ourselves.
That's so weird. I've unmuted everybody like 5 times. I'm sorry about that.
Okay. Go ahead, Brittany.
Hi there.
Someone else go.
Okay, Luisa Cardona from the city of Atlanta. An occasion where I believe that language access is critical is, for example, disputing a water bill.
Absolutely. Yeah, public utilities, disputing water bills, even signing up for water service when you move into a new apartment, or getting gas turned on, for example. That's a really good one. Thank you.
One that I work on in my day-to-day work pre-COVID-19. Brittany Ford from Toledo is workforce development and job training programs.
Yeah,
So
absolutely. Access to financial or to economic opportunity, resume workshops, professional service jobs, career fairs, et cetera, et cetera. That's a really good example as well. Thank you.
Hi, my name is Valerie. I'm also with the City of Atlanta, Mayor's Office of Immigrant Affairs. One classic example would be when our firefighters have to explain to someone that they need to get medical help and the person doesn't want it. So they need to explain to them that you have to sign a waiver form, and just getting somebody to understand that, yes, I don't want that, but I don't speak English and you don't understand me. It's always a challenge.
Absolutely. Yeah. Thank you for sharing that. I think that any access to public safety or public services is fraught enough. And then you add the additional complexity of language access and people not wanting or resisting interpreters. And that's sort of like a whole nother level of even getting people to understand what their rights are and what a waiver is, right? That's great. Person with the fussy baby, you have a pass. I totally get it. I'm a mom of 2 myself. So who's next?
ooh,
Hi, I'm Susan Berg-Herman from Asian Services in Action in Akron, Ohio. I mean, gosh, just mail, just the everyday function of reading your mail and being able to sort through it and understand it.
Absolutely. I continue to unmute everybody, and I just don't know why it keeps muting you all.
Thank you. Well, I tried to mute myself again so others could talk, so there wasn't background noise, because I have a dog and I don't want him to start barking. And as soon as I did that, I couldn't unmute myself. So as soon as you mute yourself, like, I don't know, Susan, if you can unmute yourself again, but when I went to unmute myself, it said the host couldn't, so sorry. So hi, I'm Karen Philippi. I'm the Director of New American Integration for the State of Michigan's Office of Global Michigan. And one of the areas that comes to mind to me, especially right now, in and amongst all the other issues around COVID-19, is access to information about business, whether that's startup or financial capital or how to start a business. Any of that type of information, I think, is needed in terms of being accessible.
Absolutely. Especially it's such a scary time for small businesses, where even as a native English speaker and a business owner, I have trouble understanding all of the information that's coming at us because it's changing so quickly, and the different sources of funding are constantly changing. So that's a really good one too. Why don't we go ahead and hear from just 1 or 2 more of you?
Hi, I don't know if you guys can hear me. My name is Eva. Can you guys hear me?
yes.
Okay, so I wasn't sure. Hey, my name is Eva and I work for the city in Louisville in Kentucky. Something that I see or that I have experienced with the communities that I work very close with the Hispanic community. I'm from Mexico. And I've seen parents having trouble trying to navigate the education system, like how do I enroll my kids, and then following up later on, like with the meetings, with the parent guides and all the notes that they get from school. And sometimes it's not just the fact of getting things translated or not, but helping them to navigate through systems that sometimes doesn't exist back in their homeland countries or where they come from, where we come from. So that's something I feel is like a mix between language, but also cultural navigation through systems that cannot exist or can exist in other places.
Absolutely. Yeah. I mean, this is something that's so pervasive that affects people at every layer and every level of their everyday lives. And so thank you for sharing that. Can we get 1 more? Just to make sure that everyone's blood's flowing.
Mm-hmm.
I think we have Keisha, Adam, and Susan, who we haven't heard from yet.
You heard from Susan.
Thank you. All right.
I'm Keisha Fields. I'm from Johnson County, Iowa. And one of the things that I've run into, because I used to work in the public health department, was food licenses. and the issue that people who don't speak English as their native language, trying to understand those licenses, those license applications. Yeah.
Yeah, that's a really good point too. And so I'm going to go ahead and go back to our slides now and talk a little bit more about this. So there's just sort of like a little bit of everything in language access: education, financial services, food and medical services. And these are just some that I've heard doing this exercise with other groups. Mental health services, public safety services. Some of these you have mentioned, and some of them are just up here so to kind of create a visual picture of just the tip of the iceberg, right? Housing, emergency medical care, maternal health care, preventative health care, education, public utilities, public transportation, financial services, libraries and cultural institutions, professional services, everyday navigation, communicating with your community, shopping, meeting basic needs, government announcements and information, public benefits, social services, resources and connections, scheduling appointments and making phone calls, you know, understanding community norms, law enforcement, driver's licensing, home ownership. And you may or may not have already encountered some of these issues in your own work, but every single one of these issues has a ripple effect and leads to more problems down the road. And this is sort of an abbreviated look of what it looks like to navigate life as an English learner. And because it is so hard for people to access these services, you know, one by one, each of these services every single day, you know, English learners are exhausted before they even get to you, right? Before they even attempt to connect with services, they are contending with not being able to connect with all of these things and more every single day. And this can really cause people to withdraw. And as a result, a lot of people don't even attempt to connect with these services anymore. They kind of become harder to reach, and when people become harder to reach, it turns into a sort of a feedback loop that affects outcomes for everybody, not just those who are most affected by language isolation. So this is really what the heart of language justice is. It's fighting hard to break that feedback loop by leading and by doing the hard work of building language access infrastructure, which I understand is a basic concept for a lot of you, and many of you and most of you have done this hard work already, but really connecting with what it means for people and how hard it is for people, I think needs to be the basis of these discussions, especially when we talk about later in this series, how to advocate for language accessibility with decision makers and funders, et cetera, et cetera. So language access is also the law, right? We have, you know, lots of human stories and anecdotes to share with people, but when we talk about appealing to funders and decision makers, sometimes funders and decision makers aren't compelled to act and to implement language access language access services just based on social justice. And there are a number of reasons for that, but we will discuss those reasons and sort of how to advocate for language accessibility measures and communicating value and urgency with these decision makers in a later workshop. But for now, with any basic discussion of language access, we have to talk about the legal basis. And there are three main pieces of legislation that mandate that reasonable actions be provided to any program or for any program that receives any federal funding. So these are the big three, and there is ample legal precedent behind all of these. So these have held up time and time again, all the way to the Supreme Court in the case of Title VI. And you know, you can always refer back to these laws if you need to justify why these services are important. So the first is Title VI of the Civil Rights Act of 1964, which prohibits discrimination on the basis of race, color, or national origin in any program or activity that receives federal funding assistance. There's also an executive order called EO 13166 that holds federal agencies accountable and to the same standard as recipients of other recipients of federal funding. And that is working to ensure that recipients of this federal funding provide meaningful access to English learners. Section 1557 of the Affordable Care Act is the third, and this relates to healthcare specifically, but they're all connected to each other in that they prohibit the discrimination of anybody on the basis of race, color, national origin, sex, age, or disability in this case, healthcare programs or activities, any part of which receive federal funding. And pretty much everybody gets some federal funding from somewhere, right? So that might mean that you are a medical provider who treats patients who have medical assistance, right? That is federal funds. Most foundations get some federal money. Most social service programs. I mean, so really everybody that we're going to encounter for the purposes of providing language service, this is going to be really important. And from a purely legal perspective, I like to think about this in the context of the Americans with Disabilities Act. Obviously, not speaking English is not a disability, not a physical disability, but the legal framework is a really interesting comparison because both are federally mandated and the sort of set of problems is very similar. So, for example, if you are a member of the deaf community and you go to a hospital, you will immediately be accommodated with an interpreter. But if you are, for example, a Swahili-speaking patient at the same hospital, it will be much, much more difficult for you to receive any kind of language accommodations, if any at all. This is sort of because there's a culture of accessibility and legal enforcement around the Americans with Disabilities Act. In 1990, when ADA was newly enacted, we were fighting this same fight to convince hospital administrators and governors why wheelchair accessibility is a thing and why ASL interpreters are required and how to create accessible spaces. And I think that understanding language justice, language access, and the legal basis for both are the first steps in advancing that culture of language justice in our communities, in our governments, within our organizations. And so, like, you know, you wouldn't advise a hospital to put plywood on a staircase and call it a wheelchair ramp. And similarly, we should learn and help others that, for example, children can't be used to interpret for families, right? So not exactly the same thing, but very similar. And I think that can be a very powerful anecdote to sort of help people understand that this is a legal right and that it is important and that it does matter. So I want to kind of wrap up this just kickoff workshop with a guided discussion about what it really feels like to be an English learner in the United States. And afterward, we can use any time that's left over to do a Q&A and a discussion about language access in the context of your own work. But also, please remember that if we don't have enough time for a really robust Q&A, to go ahead and sign up for those one-on-one coaching sessions with me. I will share the link shortly. And you're all eligible for those at any time through this Welcoming America initiative. So yeah, I'll send the sign up link in the comment section in a few minutes, and then I'll also send a follow-up email to each of you. So I had asked earlier for you all to think of a story of a time in your life when you did not feel understood or you did not feel like you could communicate. And I want us to share those stories now. And then I want you to really talk about how this situation made you feel, right? And this is when we talk about empathy, really what we need to be thinking about. And I will sort of share my story, which is very silly. I mean, these stories can be, you know, anything from being lost in a foreign country and being scared to something more serious, to something silly like when I ask my children to put their shoes on for the 1100th time and they just don't seem to understand me, right? So this doesn't have to be like a really intense story, but I do want to get at how it makes us feel. So I'm gonna stop the screen share again, and hopefully the muting problem is all solved. Oops. And my story, just to kind of give you an example, is when I first moved to Mexico City a long time ago, this was about 20 years ago, I didn't speak Spanish all that well, and everything was very fast and people were talking super quickly, and I was at a party with some friends and I was feeling really embarrassed about my level of Spanish, and I kept trying to tell people that I was embarrassed, but instead of saying embarrassed, I said embarazada, which actually means pregnant. And so it turned out that I was walking around this party telling everybody that I was pregnant, you know, while drinking beer, and everyone's like, okay, whatever. And eventually, you know, people, you know, said, hey, you know, that doesn't mean embarrassed, that means pregnant. And everybody got a good laugh, and, you know, I was able to laugh at myself. But really underneath that, you know, kind of self-deprecating humor, I felt shame, right? And I felt embarrassed, and I felt different, and I felt other, right? Even just in that little exchange. So that's my example of a story about how language access, or how language made me feel. And now I would really love to hear from everybody, if possible, to really dig down into the empathy piece. So, you know, maybe I'll call on people, since I haven't met you all in person, just to sort of make sure that we don't miss anybody. And I'm just going to go from top to bottom over what I have over here in my sidebar. So Brittany, that means that you're first. Oh, you're eating. I'm sorry.
No, it's okay. It's okay. I'm
okay.
Like in snack mode constantly these days. So I remember I, in college, studied abroad a couple of summers, and I was in Poland for the summer. I was like 21, 22, and I had a friend and I got lost in a neighborhood in Krakow, and had to climb a fence, and ended up in a space that was guarded by a security officer, and had to like try and sneak by them, and they stopped us and were grilling us on what were we doing, and they argued with me for like 5 minutes that I didn't speak Polish, and I kept telling them I'm an American, I speak English, and they didn't believe me. And it was, I mean, I was just really young and naive, and so it was really scary for me at the time.
Yeah, scary is one that I hear a lot, you know, being afraid, not knowing, feeling nervous, feeling anxious, all of those things definitely are provoked by not being able to communicate. So thank you for sharing that. Do you have any other feelings that you can associate with that?
Oh man, it was so long ago. In hindsight, it was really funny because they were arguing with me that I didn't speak Polish, and I'm like, why would I lie about that, you know?
Yeah. Well, thank you for sharing that. All right, who is V Mills?
That's me, Valerie.
Oh, thank you. I'm sorry, Valerie.
Some years ago, I was ill, and I was in Munich for medical attention, and it was a German hospital, and I spoke English. But I realized that because I hated being ill, and I wanted to get out of there as quickly as I could, and I didn't understand what was going on, but I realized every time I smiled, people went the extra mile to help me to understand. So in about a day or two, I was there for a bit. In about a day or two, I was known in a pretty huge hospital as the English patient. You know, there's a book.
That's a really sad story, the actual one. Yeah.
There's a book called The English Patient. So I found out that, and sometimes when I'm talking about language access to people, I'm sharing that with them. I say to them that being nice and smiling and being courteous has no language barriers, and people can tell. And so every time I tried to be a good patient, people went the extra mile to help me to understand what they were asking me to do or what I had to take, that kind of thing.
That's great. And how did that make you feel?
It made me feel, well, it helped me to keep my discomfort in check and be extra nice so I could get it back.
That's great. It's good to have positive stories about how language affects us all sometimes too. So thank you for sharing that. Adam, are you able to share? All right, I think we're missing him, so we'll come back to Adam. Oh, we got a message down here. He says, one moment. So I'm going to skip ahead to Ava first.
Yes, can you hear me there?
I can, thank you.
So my story is when I was 16 or like 15, 16 years old. That was the time when I was first learning English, and I went to Canada for a summer. So I was very excited about that. And that was the first time I was ever abroad and far from my home, but my brother was living in Canada at the time. So I was with family. So that made it a little bit easier. But I remember the first time he took me to the school where I was supposed to be studying English and learning English. He said, from now on, you're gonna have to take the bus by yourself. And that was the first time ever in my life that I was taking a bus. And I was like 16 years old. I felt so grown up. We're in a big city, Toronto, from one place to another place. So that happened. And the very first time I did it, because I didn't do this in Mexico, the city where I live is very close. So I either walk or go with my parents, or just to go with my parents in the car. I didn't really know exactly the dynamic of the buses, some common rules that now I understand very good. And I sat in the first seat, which we all know. I'm sure you guys might be thinking, oh, those seats are usually reserved for people that needs them the most. So I sat over there, and the first block stopped for a second, and then someone's come in, someone who actually need the seat. Well, he looked like, oh, and he started talking to me, but I didn't have any clue. I have some basic English, but I couldn't understand not a single word because he was speaking very fast and very, very low. And then a second later, when I realized, there's a woman who stands up in front of me and start basically yelling to me. And then I realized, then I was able to understand her better, and what she was saying, and what my memory kind of like put together is like I was doing something wrong and I was affecting the person, and I needed to complete something differently. So that day I got very scared. So I got off the bus and then called my brother. Then he picked me up, and then I explained it, and I said, I remember the feeling. I said, I'm not mad, because I'm actually very embarrassed that I made someone, being like someone who needed the shirt, and I didn't understood that he needed the shirt. And I remember that I was a little bit scared, because even though she was doing the right thing, I felt like I couldn't tell her, I'm sorry, it wasn't, my intention. Mm-hmm. But then I got very motivated. This next day, I get on the bus again. I was actually able to see the guy again. By the end of my summertime, I was able to have some words. So I was able to say, I'm sorry, I took your seat.
That's a really good example. Thank you for sharing that. You kind of feel helpless in those moments, and like disconnected and scared, and like so many emotions. So that's a really good example of something that happens to people all the time in this country when they're trying to take public transportation. So thank you for sharing. Adam, are you ready yet? Oh, inequity in public education and increased cost or decreased access of higher ed, if somebody didn't say that already. Yeah, I mean, there are definitely, oh, I see, that was for the last one. I'm reading your comments as you go, Adam. So if you are available to share your story, great. And if not, that's okay, I could just keep moving on. Okay, I'm gonna move on to Keisha.
Hi. I don't really have like a specific story, but I have things that I do where I feel as if I am less than. And it's more like in conversation where like I forget a word and then I start acting out in charades to try to explain what word I'm trying to say. So it could be like snowblower. I'm like, oh, I can't think of the word snowblower. And I'm trying to act it out for people to understand what I'm trying to talk about. And it's, I try to make a laughing, thing. I'm like, oh, it's just absent-minded Keisha. But it's kind of embarrassing because like you could think of snowblower.
Mm-hmm.
You don't use that word every day. So.
Right. Yeah. That's a feeling less than, I think, is such a big part of how language makes people feel small and disconnected sometimes. And a lot of the times when I hear from people who have lived through being English learners here, they'll say that they feel stupid sometimes, which I think is really unfortunate, right? Because I keep going back to this idea that we really need to remember that English learners are capable adults, right? And I think that without that language connection, English learners tend to feel less capable. And also advocates and service providers tend to think of them as less capable. And so breaking that cycle is really a big part of what it means to advocate for language justice. So thank you for sharing that. We only have 15 minutes left, and I do want to leave time for some Q&A. So does anybody else want to share one last story before we move on? No? Okay. Well, thank you for bearing with me for that exercise. I do think it's important, even though it's a little bit tedious, to, excuse me, to talk about these feelings, because some of the feelings that I have heard in doing this exercise, hundreds of times with different groups, large and small, are that when people attempt to access services, they feel fear, isolation, anger, dehumanized, stupid, ashamed, embarrassed, frustrated, alone, stigmatized, less than, other, anxious, depressed, lost, self-conscious, misunderstood, worried, unwelcome, unwanted, belittled, incapable, resignation, withdrawn, exhausted, hard, hopeless, powerless, invisible, and unworthy, right? So this is a lot, right? This is very, very loaded. And this is how people feel every time they try to access any of those services that we discussed a few slides ago, where we talked about it being mental health care, public safety, access to housing, access to education, access to just about everything, right? And so I keep going back to this empathy piece, because no matter how much experience we have with language access and with providing language access, I think it's really important to look at the human side of this and to talk about English learners as people, because even as advocates, I think we tend to lump people together as opposed to thinking about people as individuals and looking at those needs and really thinking about what our role is in helping people have equitable access to services. Right? So this is the basis for the conversation, right? This is the first in a series of workshops where we're going to do deep dives into different skills, into advocacy, into crisis response, right? But starting from this basis, I think, is how to truly be an advocate for language justice and how to frame this conversation within your organizations, within your groups, and starting from this base and then layering on practical skills and techniques for talking to people about language access, I think can provide everybody who attends these workshops with a really holistic set of tools that they can use to create that connection for people and to make a difference in the space of language access, both during COVID-19 and in the future when, maybe life kind of goes back to normal and we can start talking about language access planning and creating long-term sustainable policies and procedures around language access. So we've got about 10 minutes left. And this is where I would love to get to know you all better and for you to talk about the work you are doing around language access and what you're hoping to get out of these workshops, what your impressions are about language justice, et cetera, really anything that you want to bring to this discussion. This is a great time for us to do that. Yeah. So it seems that a lot of you have a background in language access. Would anybody be willing to share some of their experiences and specifically some of the problems that you're having with reaching English learners during COVID-19 with health and safety information, with keeping people safe, with making sure people have up-to-date figures and facts about the disease, et cetera?
Sure. This is Karen.
Big question. That's a big question.
It is. I'll start, Brittany. That is a big question. So one of the things that I'm doing right now, and I did this during the last time we had a state emergency situation, is I'm coordinating the translations of our COVID-19 information for the state. So I also assume whatever we're talking about kind of stays within these 9 tiles. It was extremely frustrating because for the first 2 weeks, from Michigan's perspective of the crisis, in terms of when Michigan started really seeing our cases jump up and started going into our trying to encourage folks to stay home and work from home, et cetera. For about the first 2 weeks, I was really trying to advocate for translating materials because we hadn't done anything. Yep. And so, we had leadership calls twice a day, every day. And during those calls, I was saying, we've got to get translating. We have to start translating this information. We can't just leave everything in English. And so it was really difficult to advocate. And initially we were approved for only 2 languages, Spanish and Arabic. Mm-hmm. And that frustrated me. That frustrated me because one, this is obviously a statewide issue. And in the last time we had a state emergency, it was for around a 1 to 2 county area. And we were translating things into 4 languages. So anyway, long story short, I was able to advocate to get 6 languages total for translating, but even still, there's limitations on how much we can translate because there's the cost, and I'm sure every state's like this now, right? We've got huge state budget issues. But it just was very disappointing to me that I had to advocate so hard and for so long to start getting things translated.
I have a similar example. I work for the county, and I have spent the last 6 years working with our emergency services department to develop a language access plan, but not procedural. We were going to get to that point, but like we had a section in our emergency response plan for the entire region that was about language access, and for 2 weeks they literally ignored it, and I was like, I was so upset. So I was brought in on the back end. But even then, it's not operating as it's supposed to, as it was written in the plan. I'm supposed to, or whoever is the language services coordinator is supposed to be at the table for emergency operations planning, and they're not. I'm brought in completely on the back end to, hey, translate these documents after they've been developed. And so by the time I get them turned around, they're 5 days old, So that's I'll leave it at that. There's a lot more to unpack. Our state isn't hardly anything either, so that's a whole nother thing.
Well, and it's this hamster wheel of being reactive as opposed to being prepared. And that's something that I'm really looking forward to talking about during these presentations too, is emergency preparedness as part of a broader language access plan and language access planning in general. Well, go ahead.
And what Brittany said is the same issue we're having here, and it's understandable. And at this point, we don't know how to avoid it, which is the information comes out in English and doesn't come out in another language for anywhere from 24 to 72 hours after that. And we've talked with our governor's communications offices. I mean, we can't get the documents ahead of time before they're released to the public. They won't, you know, as soon as they're working on them until they release them, basically. And so there's no opportunity to get them to us, quote unquote, in advance. But we're having that same issue, Brittany. That
but it would help if we were at that table. You know what I mean? Planning documents.
I think there has to be forethought put into that. So in terms, I think there has to be forethought put into how do you go through this process where you can incorporate language access into your rollout of your press release, your executive order, your whatever.
That's my soapbox.
And one of the things we're going to talk about is designating a language access coordinator, which I'm sure you're all familiar with, and how to really advocate for that. But talking about advocacy, Karen, would you be willing to share how you were able to successfully advocate for languages beyond Arabic and Spanish?
Oh, sure. So one of the ways, and people didn't, I don't know if people appreciated this or not, but I kind of didn't care. I was so frustrated. So the last emergency crisis we had was Flint water. It was under a different governor. But I will say one of the things that they did very well was the language access component, or as well as they could at that time. And again, we translated documents into 4 languages for one county. And so I thought that was great, right? So when I was having a hard time asking them to go beyond 2, and I kept saying, we need to do more, we need to do more. And it kind of fell on deaf ears. I'm like, okay, I need to come up with a why, right? Why do we need to do more than 2? So I started with the fact that we have 3 state ethnic commissions. We have an Asian Pacific Commission, we have a Hispanic Latino Commission, and we have a Middle Eastern American Affairs Commission. And if you're only doing Spanish and Arabic, you're leaving out one of your 3 state commissions. So that was the first, and so we are doing simplified Chinese. We asked the commission, what's the best language to encompass your commission and your constituency, and that's what they told us. So those 3 languages cover our 3 state ethnic commissions. And then we also talked about the fact that those 3 languages don't really represent the larger number of refugees who've resettled in Michigan over the last 3 to 5 years. So we looked at that population and said, okay, where have refugees been arriving from over the last 3 to 5 years? And we came up with Burmese, French, and Swahili as our other 3. And that was the reason. That's how I advocated for 6 languages total.
That's great. Yeah, thanks for sharing that experience. Does anybody else have an example of having successfully advocated for language accessibility within government? And that, you know, this is going to be a whole separate issue, but I think that's one of the things that a lot of members and in general, a lot of people who are advocating for language access want to know, right, is how do you convince decision makers and funders that this is important, right? And what are some strategies that have worked for you all, if any?
This is Lisa. It's Brett, Title VI.
I'm sorry, say that again?
You lose funding. The threat of Title VI.
Mm-hmm.
Like you are legally required. This is not you doing me a favor.
Exactly.
This is me doing you the favor of allowing you to comply with the law. And I would say the carrot with that stick is that a lot of our local media picked up that we were one of the only offices doing language access and really putting things out in other languages. And therefore it gave the city a nice win in terms of the media of saying, oh my gosh, look at what the city of Atlanta is doing and how important it is and how amazing they're doing a good job at it. And so building upon those, like, okay, you have to do it. And look, it's really great when you do it.
Yeah. I think there's real power in positivity with regard to language access. Some of you were on the webinar last week about this, where we talked about too, like, you know, using those wins to say, hey, look at the example you're setting, look at the media you're getting, you know, this is a net win for us for a number of reasons, right?
One of the concerns I have, and a concern which I think will be a reality, is as soon as we are beyond this COVID-19 emergency, we're going to go back. Michigan doesn't have a state language access requirement. We don't have a state language access bill. We've had one that's been introduced a number of times. It never goes anywhere. Obviously, separate from federally funded programming, right? But as an overall state language access, there isn't one. And so my concern is we're going to go from here back to square one you know, because they're like, oh, the emergency's over, we don't need to translate these documents anymore.
Right.
That's where our kind of how, and we're going to be facing severe budget issues on top of that. So it's going to be interesting to see how we can try and navigate some of these dynamics of, okay, we've done these in these situations. Here's areas where we think we should continue, but then how are we going to fund it?
Yeah. And this is where during the session that talks about this specifically, capturing data and evaluating your data and being able to communicate impact are going to be really important moving forward. And also looking at the negative financial consequences of, like, frankly, getting sued, right? And things like that, because there is some precedent there. Now we are just about out of time, but Keisha, did you have something you wanted to say? Because I saw you pop on.
Oh, I was saying that because where I'm at, I'm in Iowa City, and we're very diverse, that the team, our public information staff, have been like on it and getting stuff translated. But we do stuff a week in advance. We kind of have a game plan. So I'm very thankful for that. The only thing is, similar to Brittany, I'm the inclusion and equity specialist. And I would be honest, I'm probably the only diverse person in this group for our public information staff. And they brought me on later when they should have brought me on earlier. Thinking about things that, you know, their blinders, you know, are preventing them from seeing. So that's the only issue that I had, in being that voice and said, hey, did you think about this? And being the only voice. And that's very irritating. And I'm kind of like fed up at this point. I was just like, you know what, I'm just going to stay silent. But I'm also need to fight for those who are underserved too. So finding that balance.
That's a really good kind of point to end this on, is just, you know, how to, you know, fight that fight when you have limited resources, right? And we're going to talk about all of that as we move forward. And like I said, this was a very basic kind of just like, hey, this is where we're starting this program from. And I really appreciate all of your experience and everything that you all brought to the table. And I'm really looking forward to moving into some of the more applied and practical presentations in this series. And, you know, I'm going to send a follow-up just with a few little resources. I'm going to send you all a copy of EO 13166, of ACA 1557, and of Title VI, as well as some of the vocabulary that we used in this presentation, and the link for signing up for one-on-one coaching sessions. So these workshops will be every Monday at 3 p.m. And I have all of your sign up information in the Google Doc and the form that you all signed up for. So you will get an invitation usually on the same day as the presentation, just so that we can make accommodations for people who sign up late. So look for those in your inbox on Monday. And just to be mindful of everybody's time, it's 4 o'clock. I'm going to go ahead and wrap this up now, but thank you so much. Please feel free to sign off. I'm going to stop recording now. If anyone does have any questions, I will stay on for an extra few minutes just to touch base. But otherwise, thank you. And I hope you have a good week, whatever that means anymore. And I'm really looking forward to working with you all during the next 10 weeks.
Thank you.
Thank you.
Thank you.
Yeah, thank you all so much.
Mary Jane,
Oh, yeah,
I've got a quick question for you.
sure.
I don't know if it's relevant for anyone else or not. So for your 30-minute sessions, what type of things are you coaching on? And does it make sense for those of us that are going to participate in a number of these to wait until we've gone through a number of these to try and set up a coaching session with you, or do it at the beginning? Like, what makes the most sense?
Yeah, so the coaching sessions are for anything you want, right? Just using me as a resource, as somebody who's been on sort of all sides of language access. If there's a pressing issue that you're having, or you're having trouble keeping up or with, you know, sharing information about COVID-19, or if there's anything you just really want to know, right? These sessions are wide open just for any kind of language access issues or questions that you want to get my perspective on, or work through with, you know, an objective party, whatever you can. And I say take advantage of them anytime. There's no need to wait. If you have something that you want to discuss, just go ahead and jump in.
Okay, thank you.
Yeah, no problem.
I have a couple technical questions, unless someone else has a question that they want to get in there.
Sure. And just a reminder that you guys can all feel free to sign off if you want to. You know, I will not be offended, but here I am, you know, and you're welcome to stay and listen.
Seems like we're all language access nerds, at least I am, so.
Wonderful. Yes. My favorite kind of nerd.
Is bilingual helpers a technical term, or is that something that you've just kind of coined to, identify? I've kind of used with our EOC plan, I've been encouraging them to call our bilingual helpers language group advisors, because what I don't want them to do is to assume that they're a certified interpreter or translator, and then, you know what I mean? Like,
right.
Distinguish that these are people that are advising, they're not, or they're a helper. I like that term.
Yeah, that is something that I sort of coined to distinguish. You know, there are people who have their hearts in the right place and they want to help and they want to do the right thing, but they don't understand that sometimes they're doing more harm than good, or that they don't understand what they don't understand, right? They don't know that there are ethical codes and best practices that they're supposed to abide by, and neither do the service providers, right? And so I like to kind of talk about, you know, there are certified, qualified interpreters, and then there are these bilingual helpers who mean well, but who really aren't qualified to act as interpreters.
Right. Okay. And Keisha, is it Keisha? I can send you our EOC language access, but it's not like a very procedural plan. It's a much more high level thing. So
I'd love it too.
Oh, wait, we want to see it too.
Oh, maybe I'll send it to Mary Jane and let her send it out. Is that okay? Okay. It's in my experience now, I'm like, man, we're just going to make this as procedural as possible so people don't have an excuse to not do it. So it's not procedural, but I'll send it.
Awesome. Thank you. That'll be really helpful. All right. Well, thanks again, everybody. And, you know, like I said, reach out to me. Feel free to take advantage of those coaching sessions. And I will talk to Melissa about potentially starting like a Slack channel or something, maybe a group that we can all share some of these resources in. And, you know, that may or may not be possible. But in the meantime, I'm happy to facilitate. You know, if you want to send something to me, I can share it with the group. So.
Awesome.
Thank you.
Thanks again, everybody. All right. Take care.
Bye, everyone.
Bye.
Bye.